Hello everyone. Today I'm going to talk to you about migraines. A migraine is a very common disorder. We tend to see many patients with migraine headaches in any of our 4 locations at Angel's Neurological Centers. Generally, it is thought that migraine can affect females more than males. Generally, females can get migraines in one particular year at a frequency of about 18%. In that 1 year, and for males it can affect males at a frequency of about 7% in one particular year. Also, don't forget, migraine can affect children of any ages as well. There are 3 legs to treating migraine headaches. The first one is avoidance of trigger of migraines. The second leg of treatment is using as needed treatment for migraine headaches, so-called abortive treatment, and others identify that by acute treatment of migraine headaches. The third type of treatment of migraine in certain patients are preventive treatments. Those are the medications that one would take on a daily basis to prevent migraines from coming on. Today we're only going to talk about the first leg of the treatment, the avoidance of triggers. In a portion of migraine sufferers, a neurologist can identify particular triggers for their migraines, and these can range from certain food items that they take or do not take, or certain activities that they do or do not do. The other portion of patients that suffer from migraine may not have a particular trigger that can be identified by the neurologist. Nonetheless, the best method of identifying a trigger is the headache diary. I'm going to have that headache diary available to you on our website at angelsneuro.com/forms. You can download it, print it, fill it out, share it with your doctor. It is extremely helpful to them. On that diary, there are certain categories that you have to enter. For example, you have to enter at what time did your headache start, at what time it ended, on what scale was it severe, on a scale of 0 to 10, 10 being extremely severe, and also there is a scale of disability. 0 being you were not affected by it at all, you were able to continue your daily activities, and 10 indicates a severe disability that you had to actually stay in bed and couldn't continue on your daily activities. On that also are triggers that you can enter, and that can indicate a particular food items that you ate or did not eat, or any particular activity that you did or did not do. Also, there are forms to enter your medications that you took for the headaches and any miscellaneous information. That headache diary is then reviewed by your neurologist, and within 30 days we'll be able to identify any particular triggers for your migraine headaches. Sometimes digging deep into this headache diary will be quite helpful. I'll give you 2 examples. First was a patient who is a real life case. He was having headaches, turned out every Saturday morning at 11 o'clock, and when we identified that on his diary, we found out that he was having 1 pot of coffee every weekday morning, and on that Saturday he was not having any caffeine, and that was actually causing his headaches. It was the caffeine withdrawal. The fix for this particular patient was to lessen the amount of daily caffeine he was taking during the weekday, and had him wake up a little earlier on Saturdays to have a cup of coffee, and he was quite happy with his progress. He did not need any other treatment. The second, more humorous example was a very young lady who I saw for migraine headaches, and she had seen many other very well qualified neurologists in the past, and they were not successful in treating her headaches. And for a period of time we tried all kinds of medicines on her, and reviewed her diary several times, and did not identify any particular treatment that was effective for her, until one day she arrived with yet another headache diary, although this time it was heavily stained by peanut butter. And when I asked her what that stain was, she confirmed that it was peanut butter, and that she did not write it on her diary as one of the triggers because she felt it was just a snack and was not actually a food item that is worth writing. This particular patient ended up having peanut butter as her trigger, and once that was eliminated, she was a very happy camper and was offered the status of a hero in her book, and everybody lived happy ever after. So please review the diary on our website, angelsneuro.com/forms. and follow me on Facebook at Angels Neuro. Thank you very much.